Welcome back to another episode of Black Facts. October is Breast Cancer Awareness Month, and today we're going to be talking about Black women and breast cancer with our esteemed guest, Dr. Veronica Jones. Dr. Jones is a breast cancer surgeon with the City of Hope's Comprehensive Cancer Center. Welcome, Dr. Jones.
Thank you. Thank you. It's an
So
honor to
happy
be
to
here.
have you here.
Thank you.
So, I want to ask you, how does breast cancer develop?
So, cancer is just an abnormality in a normal cell. And so that cell changes and it becomes abnormal and has characteristics that allow it to grow more quickly than the cells around it and also to spread to other parts of the body. Breast cancer is no different. It arises in the breast tissue. And essentially, the breast tissue transforms into something that does not look like breast tissue anymore. It's able to spread to other organs and, cause a lot of harm in the body.
So, is breast cancer genetic?
There are a lot of reasons for breast cancer that can cause its development. Genetic is one of those, and genetic is a very important driver of breast cancer development, but it is not the only driver. And so some women have a genetic mutation or a genetic predisposition to developing breast cancer. And those women are at a higher risk of developing breast cancer. But there are women who do not have any breast cancer in their family and can still develop breast cancer. It is the one of the most common cancers affecting women. In fact, it affects approximately 1 in 8 women in the United States, and that's a pretty high number. And only about 5 to 10% of those are what we would call genetic, meaning running in the family.
Okay. So, I've heard this thing about triple negative breast cancer, and I heard that it specifically just is in Black women. So, why are we more at risk of developing triple negative breast cancer?
Yeah, you're absolutely right. Triple negative breast cancer is an aggressive form of breast cancer that is absolutely more prevalent in Black and African American women. It is not only in Black and African American women, but it is more prevalent in that population. There's a lot of research going on right now looking at why that is the case. And people are investigating that from lots of different angles, right? Is it the food that we're eating? Is it
Mhm.
environmental stressors? Is it historical, racism and these social determinants of health, which is the big buzzword in the disparities research field right now? Or is it biologic, right? Is there something that is genetically changing in Black women that is predisposing them to the development of triple negative breast cancer? And right now, that research is ongoing. We don't have a clear cut answer as to why it's developing more often in Black women, but a lot of research is focused in that area.
Okay. So, um, that's unfortunate, but fortunate that there's a lot of research going on, but unfortunate that we don't have some clear indication as to why it's so prevalent in Black women. Um, but why? I guess why is it so aggressive? Do we know that?
Yes, yes. So whenever we talk about breast cancer as clinicians or as care providers, we put breast cancer in different buckets. And what determines what bucket the breast cancer goes into is how it responds to female hormones. So, if a woman is diagnosed with breast cancer, the next thing that we want to know as clinicians is how does it respond to female hormones? You can think of female hormones like food for a breast cancer. So you can imagine the breast cancers that are dependent on food are weaker. They're not as aggressive, right? They depend on something to help them grow. Triple negative breast cancers do not need hormones to grow. They just
Oh,
grow independent of being fed by these hormones. And that is what gives them these aggressive qualities, right? They are more robust, they are resistant to kind of some common treatments that we can throw at them. So that's what makes them more aggressive than other types, such as what you would call like hormone sensitive breast cancer. Um, and I know it is unfortunate that we don't know completely exactly why it is more prevalent in Black women. I think that it's a combination of all those factors that I mentioned before. And fortunately, like you said, there are a lot of efforts surrounding attacking this problem from multiple angles. This is something that researchers around the world are working on. So,
So, what are the signs and what are the signs of breast cancer? Because I know one thing about Black women, we don't necessarily, at the first sign of feeling something, anything, we can feel, a stomach ache and we'll let it nag on for days before, if it doesn't go away, then we'll, maybe make an appointment. um,
yeah.
so what are some things that we can do since this is so aggressive? Triple negative is so aggressive. What are the signs that we can look for so that as soon as we see these signs or identify something is wrong, we can get into a physician and be seen?
Yeah, I'm so glad you asked that. The signs for triple negative breast cancer are actually the same as the signs for, say, hormone sensitive breast cancer.
Okay.
And there are some things that I want every single woman to know, and
Okay.
that's know your body and know your family history. Those two things can
Okay.
save your life. And
Okay.
so you want to know what's normal for you. You want to know what your breasts look like, what they feel like, because you will be the first one to detect anything that is abnormal. And that could be a lump that wasn't there before. That could be change in the color of the skin, change in the texture of the skin, change in the size of your breast, and any changes between the two breasts, right? If one breast all of a sudden is larger than the other, or if the nipple starts to turn inward.
Hmm.
These are things that you want to pay attention to and notify your doctor about. And really, I tell my patients if there's anything abnormal, I want to know about it,
Mhm.
right? I want you to let me worry about the change that you see without you having to try to diagnose it yourself. So I tell my patients, please do not hesitate. Call me, come in, let me see whatever change you're seeing. And I can tell you, oh, this is a normal variant, or this is something that we should look into further. And then the second thing, like I said, I want every woman to know is to know their family history, because
Mhm.
that will determine how often you get checked by your doctor, how often you should be checking yourself, and how often you should get tests like mammograms,
Okay.
ultrasounds, and MRIs. What is good for one person is not necessarily what the next person needs, right? So some women can start having mammograms at age 40.
Mhm.
Some will need them at age 30. Some
Okay.
will need to see their doctor yearly. Some will need to see their doctor every 6 months, right? And so you want to be aware of what your regimen is.
Mhm.
That way you can stay on top of the tests that you need routinely.
Okay, so what I heard you say is that we need to know our bodies, and I think most of us do. Um, we sometimes, I can say for myself, I've gone into see my provider, and they don't necessarily listen to me. And
Mhm.
because I do know my body, I will be insistent upon, no, I know that this is different. This is not how I normally feel. This is
Yeah,
not how I, whatever present. Like you said, if my breasts are doing something different. This is not how they normally are.
right.
So I appreciate that you said that, because I think that we always need to advocate for ourselves. And I think sometimes we don't do a good enough job at
Mhm.
saying, like, no, I know what I'm feeling and I need you to hear me so that we can do something about it early on. And then, second, you were talking about knowing your family history. I think that's so important. And thank you for sharing that and emphasizing that as well, because we don't necessarily talk to one another or our family, like, oh, so and so passed away from, sugar or whatever,
Yeah,
but we don't call it out. We don't like to talk about cancer, especially if one of our family members has passed, from cancer. We just don't want to talk about it, right? So I think it's so important for us to, like you said, know our family history and be willing to share that information with, our family, our daughters, or our sons as well, so that they know, what kind of diseases, unfortunately, are in our family history. um so say I don't, have a family history of breast cancer. So, yeah, I do my normal checkups and everything. But is there foods I can eat? Is there anything that I can do to necessarily prevent breast cancer?
Yes, absolutely. I think that what's important to prevent cancer is the same thing to prevent heart disease, diabetes, a host of other medical problems that unfortunately our community experiences. And it's maintaining a healthy lifestyle. Now, that's, I know, a very vague, general, broad statement. I wish I could say, oh, avoid one thing
Right.
and you'll be set. That would be so much easier. But unfortunately, that's not the case. It's these little steps that you take every day to try to make sure you are as healthy as possible, making the healthiest choices that you can make given your circumstances, right? It would be unrealistic for me to say to someone they have to eat organic food or avoid
Right.
these things when they just don't have access to that alternative. So I think for each person, I love that you said we have to be our own advocates.
Mhm.
We have to be our own advocates in every arena, whether that's in the grocery store
Yeah.
or just making the healthiest choices that we can make at every time point. So if that means increasing your physical activity, of
Mhm.
course, the standard would be to get 30 minutes of exercise five
Mhm.
times a week, right? That's the gold standard. Um, Maybe you don't have that luxury. Walk as much as you can, get out, be physically active as much as possible. Of course, you want to avoid a lot of sugar, a lot of fried foods, a lot of food with high salt content. Maybe you don't have access to healthy, to fresh fruit and vegetable. Okay, buy the frozen
Yeah.
vegetables, buy even the canned version with low sodium. Just
Mhm.
make the healthiest choices that you can make. Increase your fruits and vegetables, but there's no like one thing
Right.
to avoid or to incorporate that could help prevent cancer.
Okay.
Like I said, if it's bad for cancer, it's probably bad for diabetes. It's probably bad for
Right.
heart disease. And so just making those healthy choices at every stage is important.
Okay. So, let's say, I receive a diagnosis of breast cancer. Are there any other non-invasive treatments available other than having my breast removed? I know that that's very traumatic, for any woman. Um, but is there non-invasive treatments?
So there are non-invasive treatments. I want to address that in two ways. So I am a surgeon,
Yes.
and so I want to just talk about surgery for a little bit. And one is that surgery has come a really long way, especially in the past 30 years. In terms of how we treat breast cancer and also how we prevent breast cancer, our incisions are getting smaller and smaller. Our reconstructive techniques are getting better and better. And by law, insurance has to cover reconstruction. So that should not be a barrier for any woman. I want to let everyone out there know that reconstruction is covered as part of breast cancer treatment. So, just to dispel maybe any myths about surgery in general, there are times that we can preserve the nipple, preserve the skin, preserve the appearance as much as possible, even in a breast cancer diagnosis. Now, in terms of non invasive techniques, we are getting there. There are studies being done around the country where instead of surgically removing a cancer, we are freezing cancers. We
Hmm.
are
Okay.
treating cancers with laser treatment. We are watching closely instead of doing surgery, right? Giving medicine instead of doing surgery for a cancer. And there is actually an open trial right now looking at that as an alternative to surgery, taking medicine and just watching it. And so the field is moving in that direction at the same time that we're also trying to minimize the morbidity or the
Right.
complications from our surgeries. We're trying to make um, incision smaller. We're trying to get patients back to their lives as quickly as possible. So we're working on it from two fronts. I don't think we're there yet exactly where we have, this fully vetted alternative to surgery. But there are trials available where you can, if you're eligible, avoid surgical management for the cancer.
Well, thank you for clarifying because I was coming from the frame of mind from what I knew, um, I guess surgery to be. It's just total mastectomy, right?
Right,
Just take and
right,
then the horrible scars and different things. I happen to have some friends that in their family breast cancer runs in their family, and all of the women are on some level have been traumatized because
right,
of surgeries that they've had. And these are older women now, so I'm sure that they had, those 30-year ago surgeries. So thank
right,
you for that. Thank you for that. That was kind of the origin of why I was saying, is there any, kind of alternative things? But it's nice to
right.
know that, like you said, had never heard of freezing, the tissue, and doing laser. So it's nice to hear that there are new treatments that, I guess I should say maybe less traumatic,
Mhm,
than,
mhm,
what was previously done before. You
right.
mentioned something about trials. So I wanted to ask you, is it important for Black women to participate in clinical trials? And if so, why?
Yeah, clinical trial involvement is so critical, and I know that is a loaded statement because I am in no way ignoring the historical
Right.
injustices
Yes.
that were done, and in some cases are still being done in negligence or um, just bias. That there are a lot of issues with the healthcare system. And so I do want to acknowledge that. That being said, we cannot get treatments that work for everyone unless everyone participates, right?
Yes.
If we only have one segment of the population represented in clinical trials, guess what? Those drugs are going to work for them. They're not going to work for people who weren't included in the trial. And
Right.
so, as we move forward in the healthcare system, a lot has to be done to gain trust. Um, but we do need to do that work so that everybody can be represented in clinical trials because inclusion is so important. We need inclusion in order to develop the best treatments that work for everyone, right? We
Right.
don't want something that works for one person and then ignores a whole segment of the population because they weren't represented in the trial that developed the drug.
Right. Yeah, that's my question, my thoughts around those were, maybe we'll get closer to understanding triple negative, a little bit faster and how we can address it so it isn't so well, even if it is continue to be aggressive, we'll be able to aggressively treat it, right?
Right.
And we won't
Right.
have so many of us losing the fight, because it's such an aggressive type of cancer. So you heard it, ladies. If you find yourself in this situation,
Mhm.
definitely, I think it's important in all aspects, to make sure that our voices are heard, that we're participating, like you said, so that we are
Right.
counted. People, we are, and we have available and access to, the new drugs and different things that are coming out to treat, all illnesses, and especially breast cancer and triple negative, because it's disproportionately impacting our lives, at a greater rate. So, with that said, I know that there's stuff like Circle of Promise campaign that are designed to help, educate and end breast cancer for Black women. But what can we do as a community to increase awareness, support and to empower action?
Yeah, no, that's a great question, and I think certainly forums like this, propel those efforts. So I want to commend you for what you're doing
Oh, thank
in
you.
raising awareness and making cancer and breast cancer prevention something that we talk about, right? Something that's not this subject that's hushed or ignored, because when we talk about it, we learn more and we can do
Yes.
something about it. Um, I love October. I love Breast Cancer Awareness Month because people start talking about breast cancer more, and I do think that that's essential for all of us to be empowered to fight it. In terms of formal efforts, for any providers, care providers listening, I want to encourage hospital systems, hospitals to reach out and work with the communities around them, to make sure that the information that we gain and learn at our hospitals is disseminated in the communities that we serve. So, any community organizations that are listening, don't be hesitant, don't be scared to reach out to your local hospital and partner, right? These partnerships are what's essential to make sure that what we know gets distributed to every population.
Mhm.
And so just encourage people to form relationships with community organizations that are leading this effort, and also with their hospitals, and just be vocal, be advocates. And also, along that line, definitely stand up for yourself. I encourage all patients to get a second opinion if you are not satisfied with the answer that you were given. If you present with, say, a finding that like you said, that
Mhm.
something is going on with your body that's not listened to, find support from your community, find a provider that will listen. And I think that once we advocate for ourselves, change will come.
Yes, yes. Okay, so do you have any other words of wisdom? You have shared so many amazing, just information with the community. So, is there anything else you'd like to share with us before we end our episode on breast cancer?
Um, I think just, I just want to stress again to everyone, of course, know your body, and many of you do, which is great. Um, be your own advocate and know your family history. Those things um, will, like I said, they can save your life. So just yeah.
No, thank you, Dr. Jones. I so appreciate you coming on Black Facts and sharing with us, your expertise around breast cancer. And I know this episode is going to save a life or lives. I really do believe that with all of my heart. I believe that it's going to save lives because, like you said, once we have the information and we're knowledgeable about, you know different diseases, and specifically we're talking about breast cancer, I'm more knowledgeable. I know I've learned a lot in this short amount of time. So I'm hoping that our viewers will learn as much as well, and I plan on sharing this with all of my friends, and helping them make sure that they understand the importance of, one, knowing their body and advocating for themselves, and making sure that they know their family history. So
Right.
now I have something else to bug my friends and family about.
Yes.
And like you said, it relates to all diseases, right? It's not just
Right.
breast cancer. It relates to all of them. We need to make sure that we're living healthy lifestyles so that we won't continue to, hear disproportionately this in front of the Black community. So
Right. Yes.
thank you for joining us. I just am so honored to have you on in honor of and to bring awareness to breast cancer. So thank you. Thank you for tuning in to another episode of Black Facts. Please follow us at Black Facts on Instagram, Twitter, and Facebook, and subscribe and like to our YouTube channel so you can stay up to date on new upcoming episodes. And remember to join me for the next time for an engaging conversation so we can all know the facts. Bye, y'all. Take care.